Hello, Donovan. It's so nice to have you on the show today. How are you doing?
I'm doing excellent. Great to be here, Elijah.
Beautiful. And thank you so very much for being here. You see, I truly appreciate you. And you see, oftentimes, Donovan, I love to thank my guest for two things. And I do this so often to the point where it has become my anthem. So, firstly, I want to say thank you so very much, Donovan, for investing in yourself. You see, you are on this platform right now because you did invest that in yourself. And oftentimes, my man, I love to make reference to the amazing mango tree. Say, Donovan, some couple of months back, I was on a particular road, and just by the roadside, there was this very tall, unattractive mango tree. And I used the word unattractive because the mango tree's got no mangoes on it, and the leaves were all dry. So I just walked past it and I went my way. But you see, Donovan, just recently I was on that same road, and this time around, a lot's changed about the mango tree. You see, the mango tree caught my attention pretty good from a distance, and immediately I got the urge to move so close to it, of which I did, and it wowed me because now the mango tree's got a lot of mangoes on it. Beautiful green leaves and healthy branches, and not just mangoes now, Donovan. I'm talking about ripe mangoes. It was such a lovely experience that day. I was so excited. Here is my point. Excuse me. The fact that you dedicated your time, energy, and resources to becoming the amazing Donovan that you are today, that alone has made it impossible for me to skip you. And that's why you see you got the request for me to be on the show because I was attracted to the fruit of all that you're doing. Your philosophies, your insight, the impact your work is having, how you're offering your solutions. These stuff are amazing. And just before I sent you that request, Donovan, I said to myself, I've got to benefit from these beautiful things Donovan is doing, not only me now, but even with the audience. And here we had a day with the amazing Donovan. So thank you so very much for doing that yourself. And secondly, thank you for saying yes to the invite. Because if you had said nope, there was nothing Elisha could do about it. Thanks so much, my man.
Well, that's very generous of you, Elisha, and I appreciate the kind words.
Beautiful, my man. So let's get started. You see, I'm quite excited to have you on the show today for two reasons. Firstly, my interest in knowledge seeking. I believe in order for one to transition from a terrible situation to that of a beautiful one, Donovan, I believe it takes the application of knowledge, quality information, and not just knowledge now, but the application of it. And you see, my man, ever since I discovered that light in the Hebrew means knowledge and darkness ignorance, I've been so keen to knowledge seeking. Why? Because I do not want to remain in the dark. So that's going to make our conversation today very important to me and even to the listeners. And the second reason why I'm excited to have the amazing Donovan on the show is for the sake of the audience. You see, my man, we live in an age where information is as abundant as grains of sand. We've got a lot of information flying out there. So these folks trust me for quality, eye-opening, and very important information, of which I am totally convinced, my man, that our conversation is going to be insightful and impactful. So for that reason, Donovan, let's get started with your introduction. Talk to us about your personal or your professional journey, because right now we are so curious. We want to know how Donovan got here. Then afterwards, I've gotten some beautiful questions for you. Okay, my man, over to you.
Fantastic. So I'm Donovan Pyle. I'm the CEO and founder of a management consulting firm called Health Compass, which specializes in helping mid-sized businesses finance and procure healthcare and benefits more effectively for their employees. Um, and beyond that, I'm the author of a book that's coming out later this year called Fixing Healthcare: How Executives Can Save Their People, Their Business, and the Economy. In addition to that, I'm also a senior advisor at the Validation Institute up in Boston, which acts as a consumer watchdog agency to protect employers and by validating the marketing claims of healthcare solutions. It's great to be with you and your audience today.
Beautiful, my man. And that's a beautiful way you're doing. Because you see, we really need a lot of help in that sector, especially the healthcare. Oh boy. It's amazing what you're doing. Okay, so the first question, all right. I'm curious about this one, okay? And I've been pondering and waiting for this day. Are you ready for me?
I'm ready.
Okay, so where does most of the waste in employer-sponsored healthcare come from? Got it?
Yeah, it's a great question. So maybe just to level set a little bit for your audience, 40% of Americans get their healthcare benefits through their employer in America. So employers spend $1.3 trillion a year on healthcare, which that's approximately about 5% of GDP each year. So it's a pretty big number. And the challenge and the reason that I founded Health Compass was to help employers eliminate and reclaim the 25% that is wasted each year. So, in other words, of that $1.3 trillion, employers waste about $325 billion a year. And that equals roughly $4,000 per employee per year in waste. And when you think about, the average American makes about 58, maybe it's up to $60,000, give or take. $4,000 a year in waste, it's a huge number. And it goes beyond that as far as what the healthcare, system clinically provides as well. So there's a massive opportunity in front of employers, but only if they know how to navigate this very complex system. And so that's really was the genesis for starting my management consulting firm in 2018, and then furthermore writing the book, which is coming out in November.
Amazing. And that's one of the traits of a true leader. They always impact knowledge, share their solutions. And I can't wait for that book to get published because it sounded like a powerful one already. Okay,
But
so
but
let us,
Elisha, Elijah,
yeah,
I didn't answer your actual question. You asked why they overpay and
yeah,
waste so much
yeah.
money, and I didn't answer your question directly. So my apologies. Um, Not only, employers are largely in the dark about how this supply chain works. Okay. They don't understand the landscape of what the role of insurance companies are, what the role of benefits brokers is. And if you don't understand that historical context of how these stakeholders came to be over the past 100 years, this industry is not that old. It really isn't. It was all created in the past 100 years. But if you don't have that historical context, you have a really difficult time navigating the landscape. And if you don't know how to navigate the landscape, you're going to make mistakes. And for all the entrepreneurs, listening here, we all know this, right? I call it the ignorance tax, right? If you don't know something, you're likely to overpay in money, overpay in energy and time and resources because you just don't know what you don't know. And so there's a lot of misaligned incentives that we talk about in the book. And like you said, knowledge is power. And to add on to your metaphor with the mango tree, it's the nutrients, right? The nutrients are what allowed that mango tree to go through that beautiful transformation that you mentioned. And I live in Central Florida. And I was traveling the past couple months, and I just got back. And in summertime here, it rains. We get a lot of heat, a lot of rain. When you
Yeah,
get a lot of rain, beautiful things happen. There's a lot of growth out there that we're coming back to. So it's a great time of year.
beautiful, my man. And that's so true. Knowledge is power. When you apply it, Very important. Well, it's beautiful the work you're doing. So this is what I'm curious about. All right. So what does fiduciary-based advice mean in healthcare?
Yeah, fantastic question. This is a really hot topic in certain corners of the employee benefits and healthcare industry. Um, so to be a fiduciary, it's a legal term. It means that we're going to act in your best interest. We're going to give you advice and services that are in your best interest, right? We have a legal obligation to serve you. It means to serve. And so that's a powerful relationship. Um, and amazingly, it's a relationship and legal status that has really not come to the fore between um, the benefits brokerage industry and the employers whom they are supposed to serve, or at least that's the relationship that employers assume that they have is one of a fiduciary relationship. And in my book, I detail how understanding how the brokerage industry evolved and came to be. They served as distribution for health insurers, so they work for health insurers, right? And so that's not a fiduciary relationship. So in other words, because they work for health insurers and get paid by health insurers to sell their products, they can't have a fiduciary relationship with employers. Okay. And so, as a management consulting firm, and there are a number of us emerging in the markets who specialize in healthcare financing and procurement for employers, um, we have a different tack. We have a different business model. We don't get paid by vendors associated with health plans. And so that allows us to have an unbiased and um, agnostic perspective on the marketplace. We can give employers unbiased advice about how to best provide healthcare to their employees.
Mm, I got that, and that's a great difference. Okay, what about this one? Can rising healthcare costs actually be reduced?
Well, absolutely, and we have there are just hundreds of examples of this. So just to again to back up a second, because there's some basic baseline things that people need to understand while we're having these kinds of conversations. Um, People think that health insurers pay for healthcare. And in reality, that's really not true. It's employers and employees,
Hmm. Hmm.
families that pay for all these things. So when we talk about healthcare, what are we talking about? We're talking about hospitalizations. We're talking about surgeries, labs, imaging, prescription drugs. And so these are all the things that at the end of the day, it's employers and employees and their families that pay for these things. Health insurers really don't take on any risk. It's really more of an administrative function that they enroll, that they play. So, and I say that because it's really important. And a colleague of mine, David Contorno, who's been a great inspiration in many ways, he's got a great line on this. He says, if you want to reduce the cost, if you want to pay less for healthcare, pay less for healthcare. So, in other words, through if you're buying health, again, hospitalizations, surgeries, labs, imaging, drugs through health insurers, you're most likely overpaying for those services. Okay. So buying those services through a health insurer is not a very good, effective distribution channel. It's you're going to overpay. So in other words, here in Central Florida, at one hospital, we have two major hospitals in Orlando. At one of the major hospitals, the average insurance, health insurer pays about three and a half times what Medicare pays for their services. 3.5 times for the same exact
Hmm.
services done at the same exact place by the same exact people. You pay 3.5 times what Medicare pays. At the other hospital, you pay on average 2.8 times what Medicare pays. And so that's a really fascinating thing to have that price variance there. Not only that, but if you used a more direct contracting arrangement with those hospitals, you could pay 1.7 what Medicare pays. You could pay almost half. So there's all kinds of opportunities to deliver more value to employers and to their employees if you only understand how the system works, who does what and why. That allows you to be in a position to really manage your supply chain so that you're getting the most, you're maximizing the return on your benefits investment. And
Hmm.
that's really,
Hmm.
the insights and the methodologies that we use to deliver value for the employers that we serve.
So understanding how the system works is the key. I got that.
100%. And Elijah, one of the inspirations for me moving, I used to be on the carrier side of the insurance business. Benefits brokers were my customers. The inspiration for me transitioning from the carrier side to the brokerage side was that there's a gentleman in town by the name of Harris Rosen who started Rosen Hotels in 1974, I think it was. He became a pioneer, an accidental pioneer in showing employers how to better finance and procure healthcare for employees. He started just really taking his own path in this area in 1991, starting his own health plan for his employees in 1991. And since then, he saved his company over $500 million over the next 30 years while delivering a superior health plan for them. And
Amazing.
the downstream effects of that have been phenomenal. I mean, his turnover amongst, so he's in the hospitality industry, which has, you know, you know, um, famously high turnover rates. His turnover is half of what his competitors is. Right? Not only that, and I'll just finish with one last point. He has saved his company so much money that he had extra money to do great philanthropic things in our community. So a lot of people actually know him more for his philanthropic work, sending disadvantaged kids to college. I mean, it's just
Yeah.
unbelievable. Something that one of the thought leaders in our space by the name of Dave Chase calls the healthcare dividend. Right? If you actually manage these things more effectively, it creates these dividends that you can leverage for other areas and opportunities. So there's just tons of examples out there in the market, but we still haven't quite reached that tipping point where most employers are aware that, hey, if we actually just think about this a little bit differently, we can really drive more value to our people.
Value. I got that. So to bring this to an end, my man, what is one piece of advice, you would give to someone to reclaim wasted healthcare dollars?
Yeah. So as an employer, now I'll start at the employer level because that's the distribution channel, right? That's the employers make a lot of decisions at the employer level, and that trickles down to the employees. So I'll start with at the employer level, and that is that you have to understand, and actually this is legally required, you have to understand what the incentives of your broker is. So in other words, 81% of businesses use a benefits broker to help them manage their health plans. And if you don't understand how they get paid, by who, and how much, then you really don't know what misaligned incentives that they have within their organization, right? They might be steering you towards products and funding methodologies that might not be the most advantageous for your organization. So the first thing is to really get clear on who your broker serves, because again, that industry was developed to serve as retail distribution for health insurers. So you have to know that as an employer. And many of them don't know that. They've never been shown how much, their broker makes in bonuses from major health insurers. They don't know that. And it's a powerful incentive. So I'd encourage all employers to first get full disclosure. There's a form called a 408 fee disclosure, and it's actually the same exact form that you get from your 401k advisor on the retirement side of the industry. It's the same form, but it's now required to be done and completed for people that you're working with on the health and welfare side of the house. So that's the first step is getting clarity on that.
Getting clarity on that. I never knew that, you see. Thank you so very much for sharing that. So for folks who would like to reach out to you, Donovan, make a purchase of your book once it's out, or open your services or programs, how can that be possible?
I would encourage you to just connect with me on LinkedIn. It's linkedin.com/Donovan Pyle. That's DONOVAN PYLE. From there, on my profile, you'll be able to sign up for a free executive summary of my book, which again is coming out later this year, and we're excited to get that done. I'm actually working on the audio book now. Actually, just
Amazing.
recording. I just finished recording some music for the audio book, so that was fun
Wow.
too.
I
But
love
do you play, Elijah?
Nah.
Okay. You never know. There's a lot of musicians out there.
I tell you.
So that's been exciting. But yeah, appreciate you having me on the show here.
Beautiful. So that's going to be the end of the show, my man. Thank you for coming, and thank you for sharing this beautiful stuff with us. It means a whole lot, Donovan. Thank you.
So nice meeting you. Take care now.